This is a production of WKNO Memphis. Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
A look at the decisions and difficulties of the last legislative session tonight on Behind the Headlines. I'm Eric Barnes, publisher of the Memphis Daily News. Thanks for joining us. We are joined tonight by Senator Brian Kelsey of Germantown. Thank you for being here. Also, Senator Jim Kyle, Minority Leader from Memphis. Thank you for being here.
Thanks.
And Bill Dries, Senior Reporter with the Memphis Daily News. Let me start, and I don't know which way to go. I'll go with the majority. The session is over in record time, Senator Kelsey. Talk to me about some of the biggest accomplishments from your perspective that were achieved in the really rapid session.
You know, actually, I think the biggest accomplishment is one that very few people have looked at at all, and that was a bill by Treasurer Lillard that reformed our entire pension system in the state. And so now we're going to have younger workers who are going to have their own accounts that will have their names on them and that will have a pot of money associated with their names. And I think that's going to be a real win for everyone.
You started that bill. It's interesting because that's in some ways the frame of the national debate right now about debt and what we're paying for in long-term health care, Social Security, this whole debate at the federal, state, local level about pensions. Obviously the city and the county here are in that conversation. Across the board, Republicans, which you're a Republican and you have a supermajority right now in the Senate and in the House, by and large, you're getting done the bills that people are talking about, from pension reform to workers' comp to, albeit small reduction in the food tax. Was it, I guess, a satisfying session in that sense, in that you were able to move so many parts of your agenda forward?
Yeah, I think absolutely. It was a very successful year, and as you mentioned earlier, it was done in record time, and I think that's something to be proud of as well, the fact that we got out by April 19th. But, there were a couple of disappointments, but the beauty of this is there's a 2-year window here, a 2-year General Assembly session, and so we'll come back and we'll knock those out next year.
And we'll come back to what some of those disappointments were. But Senator Kyle, for you all the Democrats are in a minority position right now. For you, were there accomplishments in the session, and I suppose there were many frustrations?
Well, I would say there are personal accomplishments, but to say there was accomplishments as Democrats would be wrong. That wasn't allowed to occur. It was an interesting session in the manner in which business was conducted. It was done very quickly, and we'll just have to see whether we did it accurately.
Let's pick on just as a symbol of some of the bigger Republican agenda that Senator Kelsey just brought up, the reform in pensions. And this is basically, if I get it right, going from, for new teachers and new state workers starting in 2014, it's not a guaranteed benefit pension. Instead, it's more like a 401k type that is more of the private sector. What was your opinion on that specific
Let me
bill?
ask you this and ask Bill this. Why is cutting someone's pension reform? Why is reducing the amount of pension a person gets as a pension a reform? Quite frankly, the majority believes that reducing something is reforming. We reduce our contribution to public education, and that's called education reform. We reduce the pension of citizens, and that's called a reform. I wonder whether, that's a great word. We reformed our pensions. We reduced our pensions. We have created a parallel public education system through virtual schools and charter schools, and that's a reform. Is it?
Senator Kelsey, is reform just a nice word for cuts?
No, reform means that we're doing things smarter, and we're doing things by adding competition and doing things, quite frankly, the way that the private sector does them and does them well. And that's exactly what we did with these pensions. What we're saying is, would you rather have nothing at all 30 years down the road, like Illinois and California public servants are in a position in right now, or would you rather have an actual account, potentially, right? Or would you rather have an account that's got your name on it, where there's guaranteed funds in it that you can actually control, and where you can say, okay, I want this money invested this way and not this way?
Bill.
Do you think that the state, though, has a responsibility? Because it's not like with these changes that the state is getting out of that business. So can the state walk away from certain responsibilities in the name of quote unquote reform?
Well, what the state ultimately has to do is make sure that the state is serving its taxpayers well and make sure that the state is not going bankrupt. So that's why you have to make some tough decisions. I will say even the Democratic majority did a fantastic job of keeping our pension system in great shape so that when we inherited the majority status in government, we had a great pension to work with. But the only way that that's going to happen in the future, 30 years down the road, is if we make these tough decisions now. And we ultimately went with a hybrid plan that does allow for some sort of guaranteed benefit to the workers as well.
Senator Kyl, with Democratic majorities, there were talks of changes. I won't use the term reform, but I'll say that there were talks about changing the pension system. Was it more of an internal debate among Democrats than it was an actual effort to make adjustments?
I don't think when Democrats ran this place there were many internal debates among Democrats. I think that the entire government was involved, a majority, minority, whatever the case may be. In regards to the pension issue, I mean, we have a pension plan that, I actually once voted to increase pension benefits because our investments had done so well. I mean, that isn't the case today, but that will happen again. I mean, if you want to create a gloom and doom situation, you will. I will say that Treasurer Lillard did a very good job in listening to people and selling people on the plan. I want to be just quite honest. I ended up voting for the plan because I thought it was the thing that I needed to do as part of the leadership of the government that we had decided to set down this path. Mm-hmm. But the days of guaranteed benefits are over, private sector and in the government. Now, whether that is a reform or not is we could sit here and talk for the rest of the day about that.
But the education reforms that you talked about in particular actually began under Phil Bredesen when he was governor.
I would say to you where we are in public. I mean, the real interesting decision. The state legislature essentially this year took ownership of public education in Memphis and Shelby County with the voting for the municipal school bill. I mean, whether it succeeds or fails, a local issue like that, the state has now injected itself and needs to be held accountable for the results of what happens.
And you were opposed to that. You spoke against it on the floor. You talked about that everyone talked about municipal schools, the cap being lifted, and that the suburbs of Memphis are going to take advantage of that. But you also talked that there were there are 90 counties, 90-something counties in Tennessee. Other cities, other communities could be affected by this bill in ways they don't necessarily anticipate.
Well, that ultimately will occur where you have a municipality that has a socioeconomic status greater than the rest of the county. The option is always going to be out there now to create your own school system and not be with those other folks. And is that where we're going as a society here? We don't want to be with the other folks, whoever the other folks are.
Senator Kelsey, on that, the municipal school district, that obviously has taken up a lot of energy, a lot of time. We've talked about this whole school, consolidation and now deconsolidation, I guess, if that's a word. Is that, from your perspective, you represent Germantown, you were obviously in favor of this municipal schools bill. Is it about socioeconomic issues purely, and is it about just Germantown being able to break free of Memphis?
No, I think there are a lot of things going on. In fact, the number one major advantage of passing the bill is that I think it keeps suburban Shelby County residents in Shelby County, and it keeps them paying Shelby County taxes. And if you had forced people to be a part of a school district that they did not obviously want to be a part of, then I think they cross the county lines, and then those Memphis City school children lose that revenue that they're right now that they're getting. And so that, I think, is ultimately the biggest positive.
And do you see, to Senator Kyle's point about, the state has injected itself into local schools, does the state now have a responsibility to make both the suburban schools that break off, municipal schools that break off, successful and the city of Memphis schools successful?
Well, I think the state is injecting itself a lot more so in local school districts throughout the state, not just on this one particular issue. And I think that's a good thing because, quite frankly, they have not been very successful in Tennessee.
But isn't that antithetical to a kind of typical Republican position, which is that you should local control is what's important. That you don't want the federal government interfering with state issues, and the state shouldn't be interfering with county and city issues.
That is the biggest change we've had in government since the Republicans have become the supermajority, and that is the injecting our viewpoint, meaning the state's viewpoint, into local issues. We don't think you should be having prevailing wage. We don't think you should have, so we're going to say you can't do it. We don't think you should be able to do this, so we're going to say you can't do it. I mean, we have taken more and more away from local governments if we don't agree philosophically with what the local government wants to do. And that is, I mean, it's a redefinition of conservative republicanism in Tennessee, I'll tell you that.
I absolutely agree that we have done a number of those things. I was the sponsor of the bill that ended the living wage and the prevailing wage here in Shelby County, and I was proud to sponsor it. But I don't think that it's inconsistent with principles of federalism. I think it's a misunderstanding of federalism. As I've told people before on the floor of the Senate, that cities and counties did not band together to fight off the British to create their own state and then preserve certain rights to local government. No, of course, it was states that did that. And when they created the U.S. Constitution, they preserved certain rights to the states. However, the states decided to create cities and counties, and they can abolish them at any time. And if they are doing things that are antithetical to the actual citizens who live in those cities and counties, then I think absolutely the state should be stepping in.
But why then, okay, if we take your argument another step, why then are you so opposed to the federal government getting involved in healthcare, say Medicaid? You were adamant that should not happen, that the state should not take the expansion of Medicaid dollars. But how is that different than the scenario you just described?
Because that is the system that we have under our Federalist Constitution. It's one that reserves certain powers and rights to the states. There are no powers and rights that are reserved to local governments under our U.S. Constitution and really under our state constitution, with one or two exceptions for home rule.
Your take on that?
They sound like Dixiecrats.
And what do you mean by that?
In the sense that when we disagree with the federal government's position on a major policy issue, health care, therefore we are going to claim states' rights and say that's not what we ought to be about. We had the same thing happen in the 50s and 60s when Southern governments, Southern state legislators did not agree with the federal government on a position, and therefore they tried to break away. The politics of this is that local control has been the standard that Republicans ran on to take this majority, and now that they have the majority, they're not trusting local governments. Before this program is over, I'd like to talk a minute about what I see as the biggest failure we had this session, which was not addressing the issue of the sequestration. We put $58 million in our savings account, while Meals on Wheels folks are going to lose their meals.
So you would have, and this is the savings account, people call that the rainy day fund. There's a big surplus. I think it'll be at $450 million or something by end is what the budget projects. You would have liked to take some of that money to supplement what the state lost from the federal sequestration.
I would like to have had that money available for the governor when he felt it was important, and we tried to get that done. We could not get that done. We could not convince the majority that we should have put that money aside and then see if we needed it. I mean, you're going to hear, and the folks watching this program are going to see cuts in very important programs, and people are going to be suffering through no fault of their own. And we could not get that accomplished. And I truly believe that we should have done that. The same thing, also where we go with under health care, under not participating is
in the Medicaid
In the
expansion.
Medicaid
Well, let's talk for a
expansion.
second about just the sequestration part.
And I think
It's
Senator Kelsey is great to talk about that since he tried to stop every bit of that.
Right. I mean, why not? If the state has this surplus, they're in good shape. Why not carve some of that out for the neediest folks in Tennessee?
Well, obviously, we do that all the time with our $32 billion budget. I mean, a lot of it is spent on health and welfare, a good chunk of it, probably 1/4 to 1/3 of it. But at the end of the day, our job is not to make up for the federal government when it cuts its spending. I mean, quite frankly, as we all know, the federal government needs to cut a lot more spending. And this is still an open question on the federal government level, and they will decide this over the next few months. And then we can come back in January and take a look at where we want to be involved in Tennessee.
Bill.
But there is an ongoing relationship between states and the federal government, particularly when it comes to Medicaid. Governor Haslam indicated to me 2 weeks ago, I believe, that he's still talking with the Obama administration to see if something can be worked out on terms of the Medicaid expansion. Do you intend to bring back your bill next year that would effectively have the legislature say, no, you can't do that?
Absolutely, I do. I feel very strongly that this is money that Tennesseans simply do not have, and that this is a program that we should not be participating in. So I'm very glad that Governor Haslam, at least on the temporary level, made the decision not to expand Medicaid this year. I think that was a win. But going forward, he obviously is still trying to get involved in it. And if he does, I will ensure that we have a vote on that. And
to
hopefully
review
we
for
won't do
people
it.
who haven't followed this closely, I mean, the federal government's going to cover those Medicaid costs for some 3 years. The governor has said, well, we just don't want to put everybody into TennCare. We want to get private insurers involved. You don't want any of that.
Well, ultimately, the question is, do we have the money to fund our portion of this Medicaid expansion, or do we not? Obviously, it would be much better for the recipients to be in private health care than to be in TennCare, which is a woefully, a broken system.
Senator Carl, let's get you in on that.
TennCare is not a broken system, Brian. TennCare is a managed health situation for people who are sick. I mean, just because you want to pass a bill, sir, that says that we're not going to participate in the Medicaid expansion doesn't mean that people are not going to be in the emergency room at the Med being paid for through Shelby County property tax dollars. I mean, they're not going to quit getting sick. They're not going to quit getting hurt. They're not going to quit getting that. I mean, as society is aging, as the baby boomers are aging, we become older, there are more health-related issues. And you just can't pass a law that says you can't get sick in this country. And to say TennCare is not a broken system.
But you were in the Senate as well as Senator Kelsey when the state had to make some cuts to the TennCare program. Is his fear that might happen again is a legitimate fear?
No, I don't think it's a legitimate fear at all. And it's like we don't want to do this, so we're going to say the federal government is not going to fulfill its obligation 3 years from now. When was the last time that ever happened?
1981.
When the federal government didn't fulfill an obligation it promised. What
That was the last time. It was 1981, and the federal government had to balance its budget, and so they just pulled back on the percentage that they paid for Medicaid, and that's exactly what will happen again.
And at that point, that means, let's say that happened. Okay, they don't fulfill their promise. That means that the state wouldn't have the federal funds to keep the people who had been added for 3 years. Why not, people say, then cut them?
Because, I mean, that's just unrealistic to say that we're going to give somebody health insurance for 3 years and then take them off.
But doesn't that
Brian,
speak to the...
I sponsored a bill to do that when we had to do that to balance our budget. But we're talking, I mean, when you're talking about people, this is a life and death issue. I mean, quite frankly, there will be people who will not live because of this decision. Now, let's just be fundamentally clear here. That's what ultimately is where we're going. And we can talk about management care and managed care and this and that and whatever. But the people in this is why we have a government, I think.
What is, maybe the last question on this, but from your point of view, Senator Kelsey, for those people who get sick, for those people that Senator Kyle is talking about, what is, in your mind, their option?
Yeah, well, he's absolutely right. I mean, it is a serious issue, and this is why I said it's a woefully broken system, is because the studies show that actually you have a higher chance of dying from an infection in a hospital if you have Medicaid than if you have no health insurance whatsoever. So this is a broken system that we're paying more money for. So a lot of these people are going to end up on private health insurance, and ultimately, I mean, that's the type of system that we've got to push more and more people to get into.
Let's move on to a couple other things. The worker comp changes, that was a big priority of Haslam coming in. It was a big Republican priority. If you would, Senator Kelsey, quickly describe those changes and why they were important.
In essence, what we did was we took this process out of the court system and we put it into an administrative position. And we were one of very few states that still had it in the court system, I think one of 3 or 4. And so now it'll be a much more regulated system on the administrative side.
And it's been a very pro-business, on the pro-business agenda, I think, Senator Kyl. What was your stance on that shift in workers' comp?
Well, I did not support it. First of all, I think it's interesting. Republicans are for elected judges, and we just created a appointed judge system. We created a system where the workers' comp judges are appointed by the workers' comp administrator, and if they don't rule correctly, they won't get reappointed. Secondly, we've changed the standard. For what it's worth, I don't know that much about workers' compensation, but every lawyer I know who practices workers' compensation law, defense or plaintiff, was against this bill. And I just think that's really, sometimes you got to ask yourself about if the people who are affected are telling you they don't like it, what are we benefiting? Remember, you're not going to have lower workers' comp premiums, sir, unless you do 2 things. You change the standard to make a claim, or you reduce what you're paying for health care for the worker. The worker gets hurt. Workers' comp doesn't pay. Does that mean the worker isn't hurt anymore? Or does the worker come down to the regional medical center and get paid for their health care through your property tax dollars? I just wonder about that.
And to some degree for you, Senator Kyl, does this go back to, themes we heard in the last presidential election of makers and takers, and that, this notion that there's this big section of the country that don't pay any taxes, quote unquote, and just take. They take, be it pension, government pensions, or be it workers' comp, or be it Medicaid, government health insurance. To you, is that what you feel being played out in the Tennessee legislature?
What I believe is that that is an anecdotal statement that people believe. And the politics always are driven by what people believe. And I believe in Tennessee, many of our citizens, a majority of our citizens, believe they are makers and there are others who are takers, and that they are interested in helping the takers because they're makers. I don't want to sound like John Wilder here. I may be channeling my John Wilder here.
You're going old school.
But I may be going old school. But the fact is, they think they are not takers until they are hurt, and then they wonder.
And Senator Kelsey, let me frame the question a little bit differently to you. Is it from a conservative point of view, that the government needs to reduce dependency? That these things, be it workers' comp, be it Medicaid, that the government can't, it's an issue of dependency, or is it an issue of cost?
Well, I think this is a flawed analogy. This is workers' comp. These are people who are working. So let's start with that idea. And they're entered on the job, and it could be anybody. It could be anyone from the highest level of management to the lowest level of employment. But ultimately, there was, for example, there was a presumption in the law in favor of the worker, and so that needed to go, and so that we have a level playing field, and we'll just say there are no presumptions. We're not going to start with anyone winning this case or losing this case.
Would you say this was more about then streamlining the process than saying, hey, we have too many people getting too many workers' comp claims?
Yeah, I think that's a lot of it is making it much more streamlined.
Just a couple minutes left, Bill.
Let me go to the voucher issue, and not directly on the voucher issue, but when the governor withdrew his legislation, Senator Norris had a lot to say about the environment in which he felt the governor's proposal was going through. He said things had become too political, and that's why the governor was withdrawing it. You had a different version of that legislation. Do you think it had become too political? Are you in conflict with Governor Haslam on this issue?
Well, we're both in favor of vouchers. I think that's a positive. I still don't quite understand why he decided to pull this bill, nor why he refused to negotiate on it. The Education Committee Chairman Gresham and I were very clear that we were open to negotiating on this issue, and for whatever reason, the governor decided he did not want to negotiate at all on this issue.
He didn't want to expand his proposal, and I believe you favored an expansion.
Yes, of course. I want as many low-income children as possible to take advantage of this bill. But the last compromise amendment that we offered him was virtually would not have changed his bill at all, and yet he refused to even negotiate on that one.
Your take on the voucher bill?
Very quickly, the governor, I've not discussed the matter with him, but it appears that as long as public schools are doing a good job, and they are, by and large, in most of our state, then there's no need to have an alternative public school system, which are charter schools, vouchers. The politics of this is there are people, particularly in the Republican Party, who want to take their voucher money and put their kids in Briarcrest and have that voucher pay for Briarcrest or St. Agnes or some schools.
And you see that as an inappropriate distribution or redistribution?
I think the governor sees that as an inappropriate distribution of funds, and that's where we're headed to the debate is on that issue. The governor is saying, yes, if you've got a failing school, why should geography decide the education of your school? If you're you're in a school district that is failing and your school is failing, then we're going to give you the opportunity to get out of there.
Okay, let me go. We just got a minute left. I'm going to put you on the spot, Brian. One of your colleagues, Stacey Campfield out of Knoxville, makes national headlines almost every session. A Don't Say Gay in the Schools bill, and also tying welfare money to kids' performance. Do you see that as a helpful? Those are helpful proposals from Senator Campfield?
I think we have way too many bills that are simply distractions from what we want to do in government, which is provide for limited government.
Okay. And Senator Kyl, you would look to take a probate judgeship and maybe leave this legislature. Are you leaving the legislature?
We'll talk about that the next time I'm on this show.
All right, we'll have you back. Thank you both for being here. Thank you, Bill. And thank you for joining us. Join us again next week. Good night.